Medicaid cuts you made today, do you see those as permanent, or are they something that in the long run, when the state census turn around, you'd like to reverse?
Well, we're going to take a look at it year by year, but we had to make a decision this year because if we didn't act, the system would have collapsed. Independent observers said we'd be owing $21 billion in a very short period of time, and that would just force the Medicaid system in Illinois to collapse of its own weight. We can't have it under so much debt. So we had to make a very difficult decision, but an important decision to save the system. It's 3 million people almost in the system. More than half the births of Illinois are in Medicaid, and it's the basic structure of Medicaid is protected. I had to make some tough decisions, but we did that for the common good.
So when you say year by year, there might be opportunities to expand some of the services or go
Well, every year you take a look at the budget, but right now that is the budget, and that is a program to really save $2.7 billion in liability for this fiscal year. If we didn't do that, the system would be under very dire straits. So, you know, every year you put a budget together, you look at everything with open eyes, but the bottom line is we had to make some tough decisions that are necessary to protect our state from having a collapse of its entire Medicaid system. That's why we passed these 5 bills. It certainly wasn't easy raising the price of cigarettes. We had to do that for funding for Medicaid, to get federal money from Washington. But also, you know, one of the good things about that is that we're going to prevent more people, especially young people, from smoking in the first place. And we found that one of the big cost drivers in our current Medicaid system is tobacco-related disease, over $1.5 billion a year. And we can reduce the number of smokers, help people stop smoking. We can save money, save lives, extend lives, and that's one of the reasons we acted today.
What do you think about the Cook County State's Attorney's Office conceding that the same-sex marriage ban is unconstitutional?
Well, I haven't seen her decision on that. I do support marriage equality, and so does President Obama, and I think that the decision, there's a lawsuit up there, is meaningful, and we'll see what the court says.
What do you tell the people that have been dropped from the program, the senior citizens that are going to lose out on Illinois Cares RX? What do you tell those folks who have nowhere else to turn?
Well, we had to make some cuts and efficiencies and reductions in the system. Basically, we preserved the core of the system for the people who are vulnerable and who need health care, almost 3 million people. We preserved that system for the people. And there are some sacrifices, and I am sympathetic to that, but the bottom line is, if we didn't save the system, more than half the babies of Illinois that are born today or tomorrow are under this Medicaid system. If it collapsed, there'd be nowhere for them to turn. So we had to make some very tough decisions, difficult but necessary, in order to preserve the system itself, save $2.7 billion of liability.
Governor, on the pensions, can you give us an update on how that's going? Do you anticipate calling a special session to address it before November?
Well, I don't know if it'll be a special session. I really hope we can get a meeting of the legislative leaders to get this important mission accomplished. We do have to reform the pension system for state employees, for teachers and university employees. I think we're very close. There's one issue that divides the various leaders and houses and members. So if we can resolve that and compromise there, I think we can do something that will last in Illinois as a reform for generations. And it's imperative, if we're going to have more money for schools, for health care, for public safety, that we end the squeeze that the public pensions, our investment in that, put every year on those important priorities. So this is something we're working on night and day.
So you're going to sign the retiree health insurance bill?
Well, I supported that. No, I supported the legislation. It passed both houses. I'm not sure it's arrived on my desk yet. We're reviewing, you know, we had dozens and dozens, hundreds of bills that have been coming in now. And so we'll look at everything, review it carefully, and act appropriately. But a lot of things will happen pretty quick.
On the pending, Governor, you're thinking in November, the fall veto session, there might be a draft?
I hope soon. I would hope as soon as we can get everybody together and singing out of the same hymn book on this very important issue of saving Illinois from $83 billion of liability for the public pensions. If we can get that done whatever time, whether it's here today in June or July, August, you know, sooner the better.
Are you going to keep all the facilities open?
I'm going to look at what the legislature did. We're going to be acting on the budget before the end of the month, and we'll review each facility one at a time. But we can pay attention to the legislative committees and that, and listen to the testimony and the people. But I am committed, and I'll say it again, to rebalancing. I do believe in community care, in independent living for our citizens with disabilities, to have a fulfilling life. We just saw some of our Special Olympians today. I'm not sympathetic to the institutional approach. I think many states have seen that community care, independent living is a much better way to go, and I'm committed to that.
Governor Quinn, the parents from some of those residents in Murphy penned a letter to you, and they're asking you to keep the funding in the budget, to keep it open.
Yeah.
They say the one-size-fits-all plan doesn't work for everybody. Some people can shift to
Well, I'm going to
community
certainly
care.
read all the letters and pay attention to anyone who communicates with me, but I have to make some decisions, and as I mentioned, community care and independent living, I think the parents, the overwhelming number of parents of those with disabilities, developmental disabilities, support that approach, community care, and that's really where we're headed in Illinois.
Your original goal on Medicaid was $2.7 billion in expenditure reduction.
Well, we wanted to save the liabilities. That was the bottom line. It had $2.7 billion in liabilities, and I think we put together a program that had very serious reductions in efficiencies. We did provide for a cigarette tax, and that'll help us get federal money from Washington. And I think those matters coming all together with the 5 bills that I've signed today will rescue the Medicaid system from collapse. And that's what governors have to do sometimes. We have to act. We proposed this in the budget address to the legislature. They acted in a bipartisan way. We had support from Democrats and Republicans. That's Illinois at its best.
So my question is, would you foresee more cuts next year when there's more time to deal with this to get to that $2.7 billion?
Well, we had a working group that worked very well together, Democrats and Republicans from both houses. You know, I could see where on an annual basis, people from both parties in both houses work with our office at reviewing our entire health care agenda and program in Illinois. We should do that annually. This year we had to do some very, very difficult things. To put this in perspective, we have about a $15 billion Medicaid system in Illinois. We had to reduce liabilities by $2.7 billion out of $15 billion. That's very hard. New York, which has a $50 billion system, did $1 billion in liability reduction. So we were able to do a very difficult challenge and accomplish it, and year by year I hope we can work together. Okay? All right. See you later. All right.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.